Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them like a ninja dash. This episode tackles the Coronaviridae, viruses that remind us how disease has shaped human history. Try these cues before we start. Which coronavirus binds to the dipeptidyl peptidase 4 receptor for cell entry? Which pair binds to the angiotensin-converting enzyme 2 receptor for cell entry? Let's spark. Most coronaviruses cause mild, flu-like illness, including the lesser-known species, 229E, AN-L63, OC43, and HKU1. However, three types, severe acute respiratory syndrome coronavirus 1 and 2 and Middle East respiratory syndrome coronavirus, have caused global outbreaks. Coronaviruses are enveloped viruses with positive sense single-stranded RNA, a helical nucleocapsid, and distinctive spike proteins that enable host cell entry. The spike proteins, shaped like crowns, give coronaviruses their name. The spike proteins of SARS-CoV-1 and 2 bind the ACE2 receptor to enter human cells. ACE2 normally regulates blood pressure and protects the lungs, heart, and kidneys. SARS-CoV-1 and 2 can damage these organs because of ACE2. ACE2 also helps modulate the immune response, but SARS-CoV-2 spike protein mutations allow it to evade immunity, making it more contagious and potentially more harmful than SARS-CoV-1. MERS-CoV spike binds the DPP4 receptor to enter human cells. DPP4, which controls insulin and immune system activity, is found in many tissues, but most abundantly in the lungs, small intestine, and kidneys, making these organs the main targets of viral damage. These viruses have similar incubation periods before symptoms appear. No evidence links them to cancer. SARS-CoV-1 spreads mainly through respiratory droplets and close contact. Human-to-human transmission is limited and mostly occurs after symptoms appear. SARS-CoV-1 came from bats and, before infecting humans, passed through cat-like mammals called civets, found in forests of Asia and Africa, and sold in Asian live animal markets. Outbreaks were often amplified in health facilities due to close contact with sick patients. SARS-CoV-1 infection, called severe acute respiratory syndrome, usually starts with fever, cough, and breathing difficulty, sometimes with diarrhea. In severe cases, SARS can progress to complications like acute respiratory distress syndrome, producing severe, potentially fatal breathing difficulty, and low oxygen. Older adults and people with comorbidities, such as heart disease and asthma, are at risk for severe disease. MERS-CoV spreads through droplets and close contact, but human-to-human transmission is limited, mostly in hospitals. Camels act as the main animal reservoir of MERS-CoV. Most cases result from direct contact with infected camels or patients. MERS-CoV infection, called Middle East respiratory syndrome, usually starts with fever, cough, and severe shortness of breath, sometimes with gastrointestinal symptoms like diarrhea or vomiting. MERS can progress to ARDS, shock, or kidney failure. Shock produces dangerously low blood pressure that damages vital organs. Acute kidney failure causes scant urination and electrolyte imbalance. Older adults, people with comorbidities, and healthcare workers are at risk for severe disease. SARS-CoV-2 spreads easily through the air and respiratory droplets, even from asymptomatic people. The virus likely came from bats, but humans are now the main source of infection. SARS-CoV-2 is the culprit behind coronavirus disease 2019, which usually begins with fever, cough, sore throat, loss of smell, and shortness of breath. Severe cases can progress to ARDS, blood clots in vital organs, or multisystem inflammatory syndrome in children, presenting with persistent fever, vomiting, diarrhea, rash, red eyes, swollen lips or tongue, low blood pressure, and heart inflammation. These viruses produce overlapping symptoms. Diagnostic testing helps identify the specific bug and guide management. PCR and serology are common to all three, but antigen testing is only available for SARS-CoV-2, enabling faster detection of this highly contagious virus. SARS and MERS are treated mainly by managing symptoms. COVID-19 therapy includes supportive care, steroids to reduce inflammation, and antivirals like remdesivir. All three are prevented through infection control measures, such as hand hygiene and isolation. COVID-19 prevention also uses vaccination, masks, and improved ventilation. Let's review. Which coronavirus binds to the DPP4 receptor for cell entry? Answer: MERS-CoV. Which pair binds to the ACE2 receptor for cell entry? Answer: SARS-CoV-1 and SARS-CoV-2. Clean sweep, monumental. Help us grow by tapping like, share, and subscribe. Check the summary table in the description. Thanks for watching. Stay glued to Med in 5.